Hello and welcome to the Health Show. My name is Sal DiBella and I'm your host. Today we have with us Dr. Levy. He was on our show before, and if you want to see his a video of what we did before and all of our videos, you can go on YouTube and you could put in my name, Sal DiBella, and you'll see all the videos, including Dr. Levy's. So we have a lot to cover today, so we're going to get right into it. So welcome, Dr. Levy.
Hi, Sal. Glad to be back.
Thank you. So if people don't know about Dr. Levy and you're tuning in for the first time, Dr. Levy is a board-certified cardiologist. He's an attorney. He's an author of many books. He is also one of the leading vitamin C experts in the world. Today we're going to talk about his new book, The Toxic Tooth, and how a root canal could make you sick. So, welcome.
Thank you, Sal.
So before we start, I'd like to get a comment on what was in the news a few weeks ago. Angelina Jolene removed her breasts, her ovaries, and fallopian tubes, not to get cancer because she had that gene. So could you comment on that?
Well, I think that's probably a bit of a drastic approach. It certainly would be one way to prevent from getting disease of those organs, to remove the organs. But especially with regard to cancer of the breast, what we're going to talk about today, namely the toxicity and the infectious nature of a root canal, it's very interesting to see that the significant majority of women with breast cancer have significant dental toxicity, usually in the form of a root canal, right along the same way that the lymphatics in veins drain the toxins out of the root canal. They share those lymphatics with the breast. So there's a lot of attitude out there that you're just unlucky if you get cancer. You're unlucky if you get a heart attack. And one of the main thrusts that I want to get across here on your program today is that yes, there's bad luck involved in a lot of things, but when it comes to heart disease and cancer, it's not so much bad luck as choice of the wrong dentist.
Okay. Now, could you tell our viewers what other kinds of sicknesses could you get from a root canal?
Well, really, in terms of direct contribution, the heart disease that we're going to talk about is the most direct because they've actually identified the same pathogens that are present in a root canal inside the blood clot that forms when you get a heart attack. Having said that, however, the root canal is a source of regular release of toxins and very potent pathogens throughout the body. And as it turns out, all diseases to one degree or another occur due to what's called increased oxidative stress. And a toxin and an infection always increases oxidative stress. So a root canal can always contribute or make worse any disease process you're going on because you have to take in that much more quality nutrition and antioxidants such as vitamin C in order to continue to win the reduction oxidation battle that your body has to fight day in and day out to maintain good health.
Okay. Now, what can a person do that is listening to you now and just finished having a root canal done? What could they do to prevent, infection or whatever comes from the tooth to go to the rest of the body?
Well, as it turns out, and this is one of the important points in the book, the root canal is what we call a fatally flawed procedure. By that I mean when you present to the dentist and you get pain in the tooth, their approach to that doing the root canal procedure is to core out the pulp of the tooth, basically take out the nerves and take out your ability to feel pain. However, it assures that there will be infection chronic in that root canal treated tooth 100% of the time. And if not 100% of the time, as close to 100% as you can, because Dr. Huggins before me came along and had over 5,000 extracted root canal teeth that had come from dentists around the country, submitted to Dr. Boyd Haley at the University of Kentucky, and he was able to assay these teeth and find that 100% of them were infected and making very potent toxins, many along the same level of toxicity as botulism. So the root canal is always infected. It's always going to be releasing toxins and pathogens into the blood. In the case of an individual, like you just said, one person who just got a root canal, what should he or she do? Well, I would say once you see all the information that there is on root canals and the degree and the toxins and the infections, you're playing Russian roulette with your health as long as you keep it in. If you don't want to consider any possibility at all of getting the tooth properly extracted, then you should definitely get on a quality program of supplementation, as broad a basis of antioxidants and vitamins as you can, and very high levels of vitamin C. And in some people, I emphasize some, this will mitigate the toxicity to a degree that you can give yourself some protection just after it was done.
Okay. Now, what about a person that has had it done maybe years ago? What are the chances of them having this problem?
No, I mean, it's a linear sort of thing. The longer you have the root canal in your mouth, the longer and more toxins and infections you're going to be exposed to. We sort of have a perverted view of health in this country today. Our view of health is after you're 35, 40 years old, good health is feeling well on 8 different prescription medications. Okay? We're accustomed to feeling and being used to the idea of losing our health after the age of 40 or 50 and treating our high blood pressure and treating our diabetes and treating our angina, dealing with cancer, all as part of the aging process. And it's not. We should be living healthy until a fairly short period of time before we're ready to die, just like the animals in the wild. But we don't. And the pharmaceutical countries, to a great degree, they have doctors believing that it's only with medical therapy that we can have any semblance of good health. The point being is, yes, there's many millions of people out there that have had root canals in their heads for decades, and a huge amount of the disease and suffering that they have is directly due to what they've been subjected to during that extensive period of time.
Well, scientifically, have they proven that root canal does give you disease?
Yes, absolutely. This is very interesting information that's just come out in the last couple of years. They've now actually, with what's called atherectomy, they've gone in with devices and actually roto-rooted out atheromas or blockages in arteries, and then analyze those blockages and find out that they have high concentrations of the same pathogens. Actually look at the DNA profile of the same pathogens and toxins that are present in gum disease and root canal treated teeth. In 2013, they did a really exciting study where they actually suctioned out the blood clots that formed in patients. And when you get a blood clot in the coronary artery and block it off, you get a heart attack. Well, they were able to suction out these blood clots, and then they analyzed the blood clots and found this same high concentration of the typical DNA for pathogens that are present in root canal treated teeth and in gum disease. Now, I I really don't know how anybody could look at that data and come to any conclusions other than the fact that the pathogens from the root canal and from the infected gums were the cause of that blood clot. You certainly didn't form a blood clot in a sterile fashion and then suddenly it becomes deeply infected after it forms. That's just not logical, and that would defy any logical use of that information. So yes, I think we now have the proverbial smoking gun. The pathogens in root canals, the pathogens in gum disease, also known as periodontal disease, are the smoking gun, and they directly cause heart attacks. They directly cause the inflammation in the coronary artery that allows the atheromas to grow over time. Incidentally, they also have similar studies where they've identified the same profile of pathogens inside atherosclerotic plaque in the coronary arteries and inside the cerebral blood vessels where people get thrombotic and hemorrhagic strokes. They've identified all these pathogens up there too. So it's not just affecting the heart, but it's affecting the heart most prominently.
Okay. Now, what about the people that have caps? Because they take the top of the tooth off and then they place a cap on the part of the tooth that's left. Could that be dangerous?
For the most part, no. A cap or a crown is typically put on a tooth when you've had extensive enough decay that the restoration would be too big. So you fill in the area that you can and you put the cap on top. But as long as the pulp of the tooth, the inside, the core of the tooth, has not been entered and infection introduced inside there, that tooth can be perfectly functional and completely non-toxic. So in general, caps or crowns are excellent restorations. It's good to avoid certain materials. It's good to avoid nickel, which a lot of dentists still use because nickel is a very carcinogenic compound. It's also good to avoid mercury. They don't use mercury in the crown itself, but oftentimes the cap is on a bed of old mercury amalgam, and that's undesirable as well. But if the tooth is cleaned out, the pulp is not entered, and you have a quality cap made of a non-reactive, durable component, that's a good dental restoration.
Okay. What about if you have an infected tooth and they go to pull it? Would part of the infection as they pulling it get in your body?
Well, actually, acutely infected teeth, where they're abscessing and they're hurting and they're just killing you, those are some of the most toxic things your body is ever exposed to. And it's not uncommon if something like that is not addressed quickly for it to cause secondary problems throughout the body and is associated with heart attacks. So for the same reason that the root canal. Because an infected tooth, acutely abscessed tooth, is releasing enormous amounts of toxins and pathogens into the blood. So definitely it's something that needs to be addressed promptly, but very important when the extraction takes place is that the entire socket is properly cleaned out completely so that the tooth is not just extracted, but the periodontal ligament that the tooth sits in has been taken out, and any infected bone has been either burred out or brought out with another device so that you're left with a nice, healthy bone outline filled in with a normal clot, and then normal healing in of bone can take place over the next 5 or 6 months.
Now, I know a dentist that in her practice, she takes out mercury fillings, and there's not many doctors, I don't think, that are out there that, if they do it, there's a lot of harm that could happen through the, if they're drilling it to get it out, the dust. I seen a video one time about people that grind their teeth. If they have too much mercury in their mouth and they're grinding it, it's amazing. They showed in this video, it had masks on and all of that, and they were grinding a mercury, and you could see the mercury dust going in the air, and supposedly that is very toxic. So could you talk a little bit about dentists that they need, I would guess, more experience in the hazard, not only for the patient, but for themselves, to breathe in this dust when they are taking out the mercury fillings?
Yes, there's no question that dentists have a very high occupational toxin exposure, and one of those is mercury. Certainly for dentists that still put in mercury, they have a big exposure. But quite honestly, probably the dentists who take out the mercury have even a bigger mercury exposure because of what you just said. Mercury inside amalgam fillings is not chemically bound. It's actually still in a fairly elemental form, just mixed with the other components of the amalgam. And when you, as you pointed out, either chew on that tooth or tap it, or if you eat acidic food, anything that can take the first layer of grunge off the top of that amalgam, and yes, you can document plumes of mercury vapor coming off of those fillings. So for the dentist, it's extremely important for them, if they want to maintain their long-term health, to take a large number of precautions when they pull out mercury amalgam fillings, the rubber dam. There are different devices that help pull the mercury away, good ventilation, good technique, lots of water, keeping the vapor minimized down. But for the most part, the dentist should also be on a good supplementation regimen as well, because they cannot prevent completely their own exposure to these toxins.
Okay. Now, how do you know if you have these poison infection from the poisons from the infection in your body? I mean, is there a test or any way of finding out if you have the poisons before it gets to other organs in your body?
You mean in the root canal treated teeth?
Yes.
Okay. Well, the point I was trying to make earlier is that we already know now that 100% of over 5,000 consecutive root canal treated teeth were highly toxic. So we pretty much know if the procedure has been done, it's infected and the toxins are present. Now, the degree of toxicity can definitely vary to a great degree from one person to the next, from one tooth to the next. I mean, I don't want people to think that I'm going to say that if you have a root canal, you're going to get a heart attack for sure, or you're going to get cancer for sure. Of course not. All I'm saying is that the root canal treated tooth can always be expected to release some ongoing degree of pathogens and toxins into your bloodstream, especially when they're in a back molar. When they're in a back molar, what happens when you eat? You just put enormous pressure between your teeth, and it makes it absolutely impossible for toxins and pathogens not to be directly expressed into the lymphatics and into the draining venous blood in the jawbone. On the other hand, if let's say you have a root canal of a front tooth or an incisor, those teeth are, number one, have a fairly small volume pulp compared to the large volume pulp of a molar. And number two, when you eat, you might use that a couple times when you're just biting something off, but you're not sitting there and grinding and grinding and grinding with your front teeth. For the most part, they're just sitting there and they're not as involved in the mastication or chewing process as your molars. So you put all of this into the hopper, and you have a number of possibilities in which the degree of toxicity and infection that gets expressed into your body is variable. What you do know, however, is that toxicity and pathogens are always coming out. And one way in which you help detect this, if you will, is with your routine blood work. One blood test that tells a lot is the C-reactive protein. The C-reactive protein is a test that will elevate when there is inflammation somewhere in the body. And in fact, a elevated CRP, for this reason, is also known as a risk factor for heart disease. But it's really a risk factor for heart disease because it's telling you that there's an infection or something else present causing inflammation to make that blood test elevate. So there's a lot of things that you can look at. You look at your blood work, you look at your thyroid function, you look at a lot of different things, your hormone status, sex hormones, all of these things impact these factors. And when you have abnormalities that are resistant and are not responding to some given therapies, many times, not all the time, but many times, it's due to some degree of focal infection, such as is present in a root canal.
Now, when people have bridges in their mouth, that's metal in their mouth. I don't know what kind of metal it is, but is that at all dangerous, having the metal in their mouth maybe 24 hours a day?
Well, that's a very good question, Sal, and this is something that Dr. Huggins looked at quite a bit back in the day. A lot of bridges or even dentures are made with stainless steel. And stainless steel is basically nickel. And nickel, yes, is highly carcinogenic, and it's not something you want extended contact to over a period of time. Now, it's not going to be toxic to the same degree as if that metal is implanted inside the tooth, say as an implant, say as the basis for a crown, versus just having it in your mouth. But there exists what's called biocompatibility tests that allow a prospective patient seeing a dentist to select the materials that appear to be least reactive and aggravating to their immune system. And that way you get relatively the least toxic scenario on a dental restoration. I think it's pretty logical that whenever you're dealing with the body, anything that's not you, not the body, will present some degree of challenge, some degree of immune challenge to you, but certainly there's a wide range over something highly toxic to something only minimally toxic or minimally aggravating to your immune system. And using testing like this, people can then, along with their dentist, choose the best materials by which to put in whatever restoration is appropriate for them.
Okay, you mentioned dentures. I'm sure there's millions and millions of people that have dentures. Now, that's plastic most of the time, I guess. So, does the bromine come off? It does wear, that's for sure, because usually they have to get them relined or new dentures. Does that bromine from the plastic, wearing it maybe, I don't know, 12, 24 hours a day, hurt someone? Dangerous?
You know, that's another excellent question, Sal, and I must say it's an intelligent question, it's a logical question, but I don't know that that's ever been seriously studied. And it would probably be difficult to study unless you had large groups of patients with one type of denture that has one thing in it and another type of denture that didn't. For the most part, I think you can comfortably say there would not be any sizable toxin exposure, but I would certainly not go so far as to say there would be no toxin exposure at all. Probably the greatest source of toxicity, dental-wise, that patients who no longer have teeth but have a complete set of dentures comes from the fact that their teeth were extracted in what's called the traditional fashion, which is they just pull them out, wait for the blood to clot, and healing as best they can, and they don't remove the periodontal ligament. They don't remove any deep infection in the socket. They just pull the teeth out, and that's it. In those patients, and this we were able to document, Dr. Huggins and I, when we worked together some 20 years ago, these people would have huge cavitations. Matter of fact, they would have such significant size cavitations that sometimes when you opened it up, you would see a communication through the whole line of the jawbone such that you could almost put a very small pencil down in that tract. And now that's something that should be solid bone, but instead it was filled with osteonecrosis, which is the same thing as wet gangrene. And in fact, they came out with some studies that inadvertently, if you will, supported this concept, because it showed that in older patients, those with the least teeth had the highest mortality. So that was directly correlating, without realizing it, that the people with the least teeth were the ones that had the greatest deal of cavitational osteonecrosis, because the teeth had been extracted in an incorrect manner.
Okay. Can we talk about some other things that you have in your book that you would say it's important for people to know?
You know, a lot of what's in the book relates to the fact that, and this is discussed to a degree as well, obviously the book is directed at the toxic tooth because that's a huge toxin exposure and provokes a large amount of disease in a large amount of people. However, it also addresses the fact that you have to identify, or try to identify as best as possible, what sources of toxin and infection you might have going on in your body if you have a chronic degenerative disease and you're just unable to find out why you have it, why it's getting worse, what you can do to ameliorate it as best as possible. This, of course, the root canal treated tooth and the gum disease are big ones. Another one that Dr. Jifties, he treated metastatic end-stage cancer patients in his clinic in Germany, and he found that 97% of his patients had root canals or other infected teeth, so those would come out as part of his protocol. But he also found out that virtually all of these patients had chronically infected tonsils, okay? And that even when the tonsil looked normal on the outside, because the root canals had been present draining the tonsils for such a long period of time, the defense mechanisms of the tonsils had become overwhelmed, and they became sites of infection rather than sites of protection. So actually, the thing that was designed to protect you from infection was so overwhelmed by the infections from the root canal that it became a chronic source of infection. And he would routinely do tonsillectomy on these patients, and they were almost all across the board infected. Now, I'm not saying and recommending that everybody go out and get their tonsils removed, but I will tell you, if you've had tonsils present when you had root canals present and the root canals come out, odds are those tonsils are chronically infected too. And if you have a disease that's not responding anywhere close to optimally to whatever treatment you're doing, nutrition, vitamins, etc., then you should give strong consideration to this tonsil removal, because it could be a significant source of infection, keeping your health down.
You know, years ago I had my tonsils out. That was the thing. You don't hear that too much anymore, as far as people getting their tonsils taken out. Is that something that they stopped doing?
No, not really. They're still done reasonably frequently in kids, because in kids, they tend to get enlarged very easily and obstruct the airway. And then when you have recurrent streptococcal infections, That in kids can set them up for rheumatic disease. So if you don't have a healthy childhood in terms of your infectious disease exposure, it's often a very good thing to have them removed. The problem is when you become an adult, as we're now discovering, when you have dental infections present like root canals, the tonsils can become secondarily infected and abscessed and stay that way for years, for even decades, and end up being a very prominent but occult reason for the problems you have later. So, but of course, the big deal is, as a parent, I would have a low threshold for getting a tonsillectomy in my child because of the fact that tonsils become not only easily infected later on in life, but because, and I can tell you this from personal experience, getting a tonsillectomy as an adult is one of the worst things you can possibly go through, in my humble opinion. It just about killed me, but I'm glad I did it because just like the description that I told you about Dr. Joseph Issel's, I had a root canal some 20 years ago get extracted on the left side of my mouth, and I developed problems that I couldn't deal with, chest pains. I was figuring I was going to get a heart attack. My CRP was elevated, everything. And I just decided, based on what I told you and nothing more, that my tonsils needed to come out. And I'm glad I did, even though it was a horrible experience, because as soon as the surgeon grabbed one of my tonsils, he told me pus started coming out. Now, you got to put that in perspective. That was pus that's been sitting in there for 20 years, okay? Tonsils, once they get infected, they don't have the capacity to heal themselves. They're very poor at healing themselves. They're only good at dealing with very small, low-grade, limited infections coming through your oral cavity, and that way they can serve you well. But they become very easily overwhelmed, and once they become infected, they just don't have the capacity to clear themselves up.
Well, talking about tonsils reminds me of a story of a friend of mine. He was a thoracic surgeon, and he dealt with heart and lung, and he used to put pacemakers in. I don't know if he does it anymore, but he developed, I guess, somehow there's some kind of maybe radiation involved doing that. I'm not sure. But he developed doing that. He developed cancer of the tonsil. Now, what was surprising to me is that, I didn't know as much as I know today, but the best protocol for that was high doses of radiation. And that's what he did. He got high doses of radiation in the neck where he couldn't eat. He would have to have IV. And what I've seen him do, believe it or not, is take oxygen a lot during the day. Behind his bed, he had a big oxygen tank, and he would take a lot of oxygen along during the day. It's my opinion that the oxygen might have had a lot to do with his survival,
I'm sure it did. That would be a logical conclusion from that, Sal. It's hard to say what might have caused his problem initially when you were saying he does pacemakers. Certainly when you do a pacemaker, you're using the fluoroscope, which you get exposed to radiation from the fluoroscope. So that would be the major, if you will, occupational hazard of putting in pacemakers.
Right, so that's where the radiation would have come from?
Yes, not
from the equipment.
Not from the pacemaker itself. Yeah,
from the equipment. Right. Okay, because I understand he had like a rubber mat from the neck down. So this is why the neck was open, and it was open to, I guess, the radiation from the equipment. Okay.
That would make sense. Yes, sir.
Right. So now, about your book, how long ago did you finish writing it and publishing it?
Well, Dr. Kulatz and I have a co-author, Dr. Robert Kulatz, and I wrote it through most of 2014, and we published it in December of 2014. So it's only been out about 5 months or so.
5 months, okay. And where can a person get this book? And you have you have a copy of it. Can you show?
Yeah, let's see. Let's see. Okay, right here.
The toxic. Don't move it around too much. Just put it down a little bit. Okay, there you go.
All right, and probably the best place to go for it would just be my website, which is peakenergy.com. PeakeNergy.com. It's featured on the front page of the website, and you can click on that, and then you can order either the physical book like I'm holding, or you can order the ebook if you're one of these modern people that like to read on your tablets and computers and iPads, etc.
Okay, so now, Dr. Levy, what would you say to a person that is looking to have their a root canal done, or maybe just had it done?
Well, if you just had it done, I would say try to understand all the possibilities that are going on and the potential toxicity that you will face over the oncoming years, and you decide for yourself whether or not that's something you want to keep in your mouth. But what's important thing is Dr. Koulas and I didn't write the book to say ban root canals. I mean, lots of medical procedures have risks. And, you know, you can get a procedure, a medical procedure, and get a heart attack, get an infection, die, have a blood clot. But what you get before you get those procedures is you get an informed consent. So all Dr. Koulas and I want to see is dentists become completely familiar now with what is present in their own dental and medical literature, namely that the root canal is associated with an increased chance of heart disease or whatever. You should just be aware.
Okay.
And that's the message.
What about an implant? You mentioned implant. I know sometimes you don't have enough bone, what I heard, and they put a cadaver bone. What do you think the safety is from the person that they got that bone from? Person that's getting this implant?
Well, you know, Sal, I can't speak with authority on that point. Dr. Koulas, my co-author, would be the one with the clinical experience on that. I would say that there are some good mechanisms that they have that can help encourage good new bone formation at an extraction site, which of course you have to have if you're going to have an implant down the road. But the important thing is that the extraction is done correctly. The socket is cleaned out, all diseased and infected bone is gone, the periodontal ligament is gone, and after that occurs, as long as you're supporting the rest of the body with good nutrition and supplementation, most people will heal in, over the course of 6 months or so, enough good solid bone to have an implant procedure take place and be a good long-term infection-free restoration.
Well, Dr. Levy, I want to thank you for coming on the Health Show once again. And maybe down the road we'll do this again on another topic. Okay, my pleasure always, Sal. Thank you for having me on. You're quite welcome. Okay, bye-bye. Bye-bye. So there we have it, Dr. Levy, and you know, looking at root canal and possibility of getting disease from root canal. So I want to thank you for joining us on the Health Show.